Hello, everybody. My name is Julie, and I'm with Julie Walton Health. Today, I'm really excited to have Dr. Lindsey Hanson on the show. She's a naturopathic doctor here in Calgary. Hi, Lindsey.
Hi.
All right, so today we are going to be talking about SIBO and digestive health. So she is a naturopathic doctor, and this is one area that she really focuses in on. She has a lot of other things that she focuses on, but this is one of her main things. So I'm really excited to have her explain to you guys what SIBO is. We're going to talk about the challenges with treating SIBO. We're also going to talk about a meal plan that we've created for phase 1 of the SIBO protocol. And then we're just going to offer some support and encouragement for people that do have digestive health issues. So thank you so much for coming today. I guess I mean, you're at home, so we're all at home. But thank you so much for coming on today and talking to people about this, because I think it's an area that I'm definitely finding, for someone that has had SIBO myself, it's way more common now. Can you just explain to people what exactly SIBO is?
Sure. So SIBO is small intestine bacterial overgrowth. And so it's where we have an overgrowth of bacteria in the small intestine where it really shouldn't be. So we have bacteria all throughout our body, but it's mainly focused in through the large intestine. And so in SIBO, that bacteria can move up into the small intestine and can start to wreak havoc and cause all kinds of digestive issues. So we can have upper digestive issues, things like heartburn or a lot of like belching and gas, also a lot of bloating. And then a lot of bowel movement disturbances. So sometimes you can have diarrhea, sometimes you can have constipation. It oftentimes just depends on the type of bacteria that has overgrown within the small intestine.
Okay. Now, and why do people get SIBO?
There are a lot of different reasons why people get SIBO, a lot. And so some of them can be different types of digestive issues. So if you've had long-standing digestive issues, sometimes you can get this overgrowth happening. Sometimes there can be that gut-brain connection. And so if a person has been through trauma, that could also cause digestive issues or SIBO to happen. There's also a mechanical reason for it. And so we have this, it's this kind of like muscle wave that moves through the intestines. It's called the migrating motor complex. Mm-hmm. And so when that system isn't kind of flushing and moving through the intestines at kind of like a healthy, regular rate or pattern, the bacteria can then kind of move up into the small intestines. Because the small intestines mainly are meant to absorb vitamins and nutrients and kind of continue to help with that breakdown process of food. And so that's why the small intestine tends to be quite kind of sterile in comparison to the large intestine, because by the time that food gets into the large intestine, it's just meant to be fermented and turned into stool, and all that waste is meant to be passed out. And so if we get that process happening in the small intestine, that's where a lot of these symptoms come about.
Yeah. So now a lot of people so what's the difference between IBS and SIBO?
That's a great question. Not a whole lot. No. So we're actually finding that a lot of people who have IBS, actually, the root of their problem is SIBO. And so I listed off some of those symptoms for you, and they are quite similar to what people are, the symptoms that people experience when they have IBS. And
which
so
is kind of exciting for people that have IBS, because they're like, I kind of hope I have SIBO. Can you do something about it?
Exactly, because there's not a lot to be done with just kind of a classic IBS type picture, or not a lot of treatment or hope options for patients. But then when we try to get down to the root cause of what's actually happening, oftentimes we're finding that it is SIBO.
Mm-hmm. Okay. Lindsey came to see me. We have become friends, colleagues, and I obviously, if you guys follow me regularly, you know that I'm all about food, creating meal plans, and just helping people eat, for their body and to eat delicious food that's really, really healthy. All right. So if people are listening to this and they're hearing the symptoms that we're talking about, and they're like, oh my gosh, I might, or they have IBS, and they're like, maybe I have SIBO, or they're hearing this for the first time and they're like, yeah, my digestion is not doing so good. Who are the best people to reach out to?
Yeah. So I think naturopathic doctors are a really great
Really?
resource. That's one of the main things that we really focus on is digestive issues. Digestion is the foundation of health. And so it's really important to get that system working really well and so that your body can absorb vitamins and nutrients and minerals. So naturopathic doctors can be a great resource. Functional medical doctors as well. They are usually quite well trained in this area.
Okay. Now, there was one thing I was just thinking about. Why is it so important for people to get this looked into? So if people are having digestive health issues, why is it so important for them to treat SIBO if they do have it?
Yeah, because digestion is the foundation of health. And so we are what we eat, and your bacteria is what you feed it. And so diet is really important, and so is digestion. And so sorting out those issues allow your body to get the most out of the food that you're giving it. So to absorb those vitamins, minerals, and nutrients. And then there is also that gut-brain connection, which is really strong. And so a lot of what's happening in your gut can be reflected in the rest of your body. And especially in regards to mental health, anxiety, depression can all be related to digestion and the state of your digestive health.
Yeah. Oh man, yes, definitely. So I've definitely noticed the difference. Like when my symptoms are at a 0, I just feel so much better just I didn't even know that I could feel like I got to the point where I didn't know what it was like to feel well. And then all of a sudden, when I was getting treatment, I was like, oh, this is nice. Like, it's just crazy how it affects your anxiety, your moods, all of those kind of things. And then all of a sudden you're like, huh, okay, wow. That's
Mm-hmm.
like, it's just really amazing when you start to realize how good it feels to feel good.
Agreed.
So let's just kind of jump into the meal plan. So why did you come and talk to me about designing a meal plan for specifically for people going through the phase 1 of the SIBO protocol?
Mm-hmm. So diet is really important in SIBO treatment. It can't be underestimated how important it is to look at diet and then to utilize diet to help manage symptoms and to help bring the microbiome back into balance and to restore that balance. And so I came to you because I know that you have a personal history with SIBO and have experienced a lot of the different diets that are involved in SIBO treatment protocols. And because the list, when somebody's given a SIBO treatment plan that involves a diet, the list for what they can and can't eat can be quite intimidating. The list for what they can't eat is usually much, much longer than the things that they can actually have. And so I found that patients were getting quite overwhelmed just with that aspect of it. What to eat, when to eat, how, all of those different factors. And so because it is an important part of treatment, I wanted to have a resource for patients that they could feel really confident about, that they could feel confident and comfortable eating these foods. And it would also help to provide some education for them on how to eat and how to eat this way, which I think is really important.
Yeah, no, for sure. And like it was really interesting. One of our mutual patients actually the other day was saying, I think that the meal plan is so bland because usually I'm creating all these funky, fun recipes. And but when I was going through the really restricted period of the SIBO diet, I love flavor. And she's like, the food tastes good. So I'm excited that people are finding that the meal on the plan do taste good, because I really think that flavor, with using natural herbs and spices and things like that can really help, just like the anxiety of when you're looking at the list and trying to create meals. It really just helps in being like, okay, I know that this meal is going to at least taste pretty decent. I know I can eat it. And just like, especially even just at the beginning when they're kind of figuring it out, and then it might just spur creativity so that they can kind of get creative on their own moving forward. So that's
I
kind of
absolutely
exciting.
agree.
Yeah. All right. Well, I'm really excited because the meal plan, it has snacks, it has breakfast, lunch, and dinner. We also provided education. We included some tips and tricks for how people can be really successful when they're undergoing the SIBO plan. So we're really excited. It's available on my website, www.juliewalton.ca. So let's just finish up, Lindsey, with some kind of what can we leave people with? Because a lot of people that are struggling with digestive health issues or say IBS, they've been kind of told like, oh, it's just you're stressed, and it can be really isolating for some people. So what can we kind of offer as encouragement or support or things to uplift people kind of on their digestive health journey?
Absolutely. I think the biggest thing is to know that you can find somebody who will listen to your symptoms and listen to what's going on and help you to figure out what's happening. And I think that that's really important. There are lots of people who are educated, like naturopathic doctors, on digestive health, and this is what we do. And our current kind of digestion or nutrition world, all the food out there isn't always conducive to a positive microbiome or a healthy digestion. And so just talking to people about about your symptoms and about what to do with it, because there are lots of ways that we can support people. So
totally. And I really liked you brought up that point. Like, I mean, there's a lot of really great things out there and people talking about digestive health in a way that is maybe preventative, or like one thing that we both probably hear all the time is, foods that are rich in probiotics, or kombucha or sauerkraut or kimchi. They're all really, really good, but for someone that has SIBO, that can be really tough for them, and it can actually flare up your symptoms. So it's really important to see someone who focuses on digestive health, so they can kind of get to know you personally, and kind of have your own individualized treatment plan. I think personally, and it actually benefits me as a nutritionist if you have a naturopathic doctor or a functional medicine practitioner or a doctor, and because they will really look at you as a whole, and then I can just focus on the food piece. And just like, working together as a team is so fun, because we can really support people that way. I just think it's so important for each person to, instead of just taking pieces from here and there, to really work with someone that really gets to know them and their health. I think that's really important. So
I think so too.
Yeah. So where can people find you? So if someone is in Calgary, I mean, there's people all over. So look into, naturopathic doctors or functional medicine practitioners in your area. But for people listening to this, and if they're identifying with what you're saying and they want to find you and work with you, where can they find you, Lindsey?
Sure. So they can just search Marta Luke Naturopathic and Wellness, and they can even book in online.
Okay, awesome. Well, thank you so much for coming today. I really appreciate your time. And if you guys are interested if you are already working with a functional medicine practitioner, or a naturopathic doctor, you can check out the meal plan on my website. Again, it's www.juliewalton.ca. But make sure you are, if you are going to download the meal plan, it is really important that you're working with someone to guide you through it. I don't recommend you just kind of picking it up, and it doesn't really work as just a one-off, hey, I have digestive health issues, I'm going to go do this program, or this meal plan. That's kind of not what this is geared towards. It's definitely geared to be used under the care of a doctor. So thank you guys so much for watching today. If you are watching this on YouTube, make sure you give it a like. It really helps out my channel. And definitely give it a subscribe. We're going to be bringing on lots of different professionals. I'm going to have some more cooking videos and things like that. Also, you can hit the bell at the top, and that will notify you every time I have a new video, so you don't miss anything. And obviously, if this is on Instagram, give it a like too. Okay, have a good day, you guys, and we'll talk to you soon. Okay,
bye.